Hi everyone, welcome back to Insulin Inspired. Today I am going to be demonstrating using an insulin pen. You may have a pen that looks different than this one. This is a Humalog Junior pen. And if you can see that dial there, this dial will dial the dose and it can dial in half unit increments. So yours may not do that. I also have a Traceba pen here. And this dial, you can see dials in 2 unit increments. So again, yours may do that. It may do 1 unit increments. And I also have an Ozempic pen here. And this pen, you can see dials with just little dash marks until you get to your prescribed dose, which could be 0.25, 0.5, or in this case, I have a 1 milligram pen. So you will see the dose displayed in the window there. There's also a 2 milligram pen available. I tell you all that to show you that the steps for using any of these pens are exactly the same except for dialing up that dose. So you can use any of these pens, follow the steps here, and just dial up the appropriate dose of your particular medication. You can see that the inside of these pens also can look a little bit different once we pull those caps off. This pen is a pretty full pen. You can see this rubber stopper here at the bottom. There's a lot of medication left in this pen. It hasn't been used very much. And on the flip side of that, this pen has been used a whole bunch of times and there's only a little bit of medication left here up at the top. So that's how they look once you've used them more. So once we are ready to use a medication, we are going to pull that cap off. And then we are going to clean off the tip here with an alcohol swab. This tip is where there's a little rubber stopper and the needle, one side of the needle is going to go into that to get down to the medication, and the other end's eventually going to go into us, so we want that all clean. So we are going to clean off that, and we're also going to clean off our skin. In this video, I'm using an injection pillow, but you would want to clean off the skin as well. And I'll often do that now, so it gives the skin a couple of seconds to dry while I'm attaching the needle so that the alcohol is dry and doesn't sting. When you are ready, you can grab a needle. These come separately for most medications, although with Ozempic, they do come in the box with the Ozempic. The pen needles that you have may look a little bit different. Mine has a green paper here, or foil. Some have a different color, some are white. It just depends on the brand and the size of the needle that you have. So you are gonna peel back whatever color paper or foil you have there. And then once you do that, there is a needle in there. So we are going to carefully screw that on, just like you're putting the cap on a bottle of water. And you want to do it about the same way you would put a cap on. You want it kind of snug, not so snug that it's never going to come back off, because we need to get rid of it. We're going to use a new needle every time. So when we're done, we do need to take it back off, but we don't want it loose and wiggly while we're injecting. So snug, but not too snug. And then we are going to pull the clear cap off. We are going to save this. We'll use it later to get rid of the needle without pricking ourselves. So we want to keep that. But the little inner needle cover, which most needles always come with two. It may be colored like this, it may be a little different shape, but we want to make sure that we pull that off and can actually see the needle. Now my needle is a pretty tiny little needle there. It's a 4 millimeter. There are longer ones. They come 5, 6, 8. There is also a 12, but hopefully most people aren't using that anymore. And then with a brand new pen, you are going to want to spin that dial up to a couple of units. You don't have to get nitpicky here. We're just looking to waste a little bit of the medication to make sure that everything's working. So we don't want a big dose here, but a couple units is fine, 1 unit's fine, 3 units is fine. We're just looking to make sure that works. And then once we have dialed that, what we're gonna do is we're gonna push this button to squirt a little bit of the medication out. When you're doing that, you can kind of see this dial spin back to 0 when you're delivering the medication. So we are gonna look for drips at the top. And if you see a few, great. Yours may not be quite as much medication as came out of mine, because I have used this pen before. So sometimes you may see a tiny little drop or none. If you see none, you're just gonna repeat that step, dial up a couple of units and squirt it out until you do see a drop or two of medication. And then you're going to spin the dial to your dose. Now your dose could be anything. There's a ton of different doses depending on which medication you're using, what type of diabetic you are, etc. I'm just gonna spin mine up to 10 units here for an example. Your dose could be very different. The bigger the dose, the further this comes out. If you have this type of pen, the Tresiba Flex Touch pen, when you dial that pen, it doesn't actually come further out at all. It just spins up a higher dose in the window. Either way is fine. So once we have that dose, whatever we're injecting, dialed in, we are ready to go. Now you want to pop the needle in gently and quickly. The only thing that's really uncomfortable is when you kind of put the needle against the skin and are kind of shaking a little bit or getting nervous and it's moving in and out. The outer layers of the skin are really what have nerve endings, so that's the part you feel. So you want to get through that part as quickly as possible. This is not a horror film. We do not need to go hard, but we do want to go quick. A lot of people will hold the pen like this just to give you a little more security so you're not wiggling. However you hold it is fine as long as it's comfortable for you. And then you're gonna pop that needle down, like I said, quickly and gently into the skin. And we are gonna push this button to deliver the medication. Now, when we're pushing that button, you can see that dial spinning. Once we get down to 0 and we're through all of that pushing, we're going to keep holding for 5 to 10 seconds to make sure that we get all of the medication that we need. And then after that, we will pull the needle straight out. Now, I didn't mention where we should inject this. So you want to inject into soft tissue. So the back of the arm, this tissue back here, you don't want to come up here by the bicep. That the muscle can be too close to the surface. It can be a little more uncomfortable. So you want this soft pinchable tissue. You can see I can't really pinch up here very well. You don't have to pinch when you're doing the injection, but pinching the tissue ensures that you're in an area that's soft and easy to inject into. You can do the stomach, you can do the top of the butt, you can do the legs, anywhere that you can pinch up a little bit of soft tissue is fine. And then we do need to get rid of our needle here. So we are going to use the clear cap. We are going to put that back on the needle, and then we are going to unscrew that whole needle piece off. Now it takes a little more unscrewing than you'd expect. And then when it finally kind of breaks loose, you are back to where you started, and you can cover up your pen to keep everything clean. It does not, most of these medications do not need to be stored in the refrigerator once they're opened. They are good at room temperature for, depending on the exact product, at least a couple of weeks, often 30 days. You can check your package for the exact specifics on the product that you're using. But most people find they're more comfortable to inject at room temperature. You can leave them in the fridge, that's totally fine. You'll just feel the product going in a little bit more. It'll feel cold essentially going in, so you may feel it a little bit more. And then we need to get rid of our needle cover and our needle. So to do this, you can dispose of it in a sharps container. If you don't have one, you can make your own. Use an old laundry detergent container, an old milk jug, something along those lines, and put them in there. And then you can go, there's a website called Safe Needle Disposal that will help you find a place local to you where you can return them. You can just put in your zip code and it'll find close places to you where you're able to get rid of those so that no one's getting accidentally pricked. I hope you found this useful, and if you have any further questions or comments, please feel free to comment below and subscribe to my channel. Thanks.